just wanted to go live so everybody could hop in. Yeah, we have 26 people here. Hello, everybody. And we are also live on Holy Trinity's YouTube channel. So tell your friends. You can find our YouTube channel by going to our website, htrcc.org, and then you click the Watch Online button, which is right on our homepage. It'll bring you to our Watch Our Online Mass page. If you scroll down a little bit, you'll see another button that says View Our Live Stream on YouTube here, and that's how you get to our YouTube channel. So I think if you know someone that was interested in the webinar but couldn't RSVP, just share that link and they'll be able to see our webinar, and it should be archived on our channel. So if you miss a bit or you want to watch it again, it'll be on there for you to watch.
Thank you, Marina.
Sure.
We'll just give it a couple of more minutes because I know we have more participants. So.
Like the sun is trying to come out.
Yeah.
It's out here.
Is it?
Isn't there a song?
Yes. There is.
Okay. Well, I'm going to start. Welcome, everyone. Welcome to Views from the Medical Front and Keeping the Faith, COVID-19. My name is Lori Arena, and I'm parish nurse at Holy Trinity Church in Westfield, New Jersey. I felt this would be the perfect time to be talking about the present state of our medical and our spiritual fronts during this pandemic. We've all followed the course of the virus through news briefings from our president, from our governor, and our mayor, and we have abided by the restrictions and the guidelines that have been necessary to help stop the spread of the virus and to keep ourselves safe, others safe, and our loved ones around us. And what this has meant for the first time ever is that the house of God, mainly our churches, have been physically closed. And for far too many of us, not being able to go to Mass, not being able to receive communion, or just to physically go to church and kneel down and say a prayer has not given us the spiritual fulfillment that we seek during these extraordinary times. And now that restrictions have lightened up and the world is reopening around us, we will hear from these three speakers who will discuss what their experience has been and the challenges that they faced, and that and the past and present state of their work. I'd like to first begin with a video clip from a young poet laureate, Amanda Gorman. I first saw this back at the height of the pandemic, somewhere around middle of April, when there was so much fear and so much panic because of all the uncertainties and all of the unknowns that we were about to face. It just warmed my heart and it inspired me, hearing the words from this young poet. I realized just how spot on she was, and here we are a month and a half later, and she could not have said it any better. So here's the video.
I thought I'd awaken to a world in mourning, heavy clouds crowding a society storming, but there's something different on this golden morning, something magical in the sunlight, wide and warming. I see a dad with a stroller taking a jog across the street. A bright-eyed girl chases her dog. A grandma on a porch fingers her rosaries. She grins as her young neighbor brings her groceries. While we might feel small, separate, and all alone, or people have never been more closely tethered, the question isn't if we will weather this unknown, but how we will weather this unknown together. So on this meaningful morn, we mourn and we mend like lights. We can't be broken even when we bend. As one, we will defeat both despair and disease. We stand with healthcare heroes and all employees, with families, libraries, schools, waiters, artists, businesses, restaurants, and hospitals hit hardest. We ignite not in the light, but in lack thereof. For it is in loss that we truly learn to love. In this chaos, we will discover clarity. In suffering, we must find solidarity. For it's our grief that gives us our gratitude, shows us how to find hope if we ever lose it. So ensure this ache wasn't endured in vain. Do not ignore the pain. Give it purpose. Use it. Read children's books, dance alone to DJ music. Know that this distance will make our hearts grow fonder. From a wave of woes, our world will emerge stronger. We'll observe how the burdens braved by humankind are also the moments that make us humans kind. Let every dawn find us courageous, but closer, heeding the light before the fight is over. When this ends, we'll smile sweetly, finally seeing. In testing times, we became the best of beings.
Before we hear from our panelists, I just wanted to let everyone know that there will be time at the end of the session for questions and answers. And if you look at the bottom of your screen, you'll see a Q&A tab. Just type in the question and who you would like the question addressed to, and we'll get to as many as possible. So now we'll hear from our three speakers. We have Dr. John D'Angelo, who is the chairman of emergency medicine of the Trinitas Regional Medical Center in Elizabeth, New Jersey. He is also a local Westfield resident, and him and his wife, Renee, have 5 children, ages 15 to 7, the youngest 2 being twins. God bless you, Renee. And we have Father Anthony Randazzo, who's a pastor of Holy Trinity Church in Westfield, New Jersey. Welcome. And Father Michael Saporito, who's a pastor of St. Helens in Westfield, New Jersey, and the newly appointed auxiliary bishop for the Archdiocese of Newark. Congratulations, Father Michael. So we will start with Dr. John D'Angelo.
Thank you for the intro. I almost feel like ending with that. That was pretty powerful, wasn't it? Thank you for the opportunity. It's an honor to be talking to everyone here, and you know, I look forward to answering any questions that you may have for me. I was asked to kind of start to talk a little bit about what it was like, maybe from the inside out, and from the inside of an emergency department, from an inside of a hospital. So I thought I'd break it down into the calm before the storm, and then maybe what it looks like today, nice and sunny, and what today brings. For me personally, it started with a disbelief, and I don't know if some viewers felt the same way, but this was a storm that I didn't want to believe that was coming. It was a snowstorm that I hoped would pass, and that it wouldn't find us, as selfish as that is, and that's the truth. And I was a disbeliever, and I can remember speaking to a colleague on a Sunday. The previous Friday, I was asked to present about COVID-19 and SARS-CoV-2. And there was some concern that this would be something more that our systems could handle, our healthcare systems at large. And I will tell you with confidence that I thought this can't be. I was asked to present, so I started reading about it on a Sunday and then a Monday, and then Tuesday at what we call Medical Executives Committee, I was asked to present to some smart people, physicians and colleagues. And once I read about the disease, once I understood the pathophysiology, the pathobiology, I was, to say the least, concerned. After I presented, when I looked around the room, when I talked about this disease as a contagion, something called the R naught, and its ability to spread from 1 becomes 5, 5 becomes 25, and so on and so on. One of the responses I got in that meeting was, "You seem like an alarmist. It's not going to happen to us. Can't be." And the question came, and so they said to me, "John, do you think we're ready?" And I said, respectfully, do you want me to answer that here, or should I answer that privately? The response was, "We want to know, do you think we're ready?" I said, "None of us are ready for what's going to happen." And as much as I wanted it not to be true. So that started, to rouse the spirit in a phase of preparations. Around 24 to 48 hours, you began to see committees open up, emergency preparedness open up to prepare for a capacity to handle certain things. Leaderships within the hospital, including myself, called colleagues. We phoned a friend in New York City. I trained in New York City, and we said, "Listen, what are you seeing?" They said, "John, I'll tell you what we're seeing." And so they told us, and I'm so grateful for them and for that experience, to begin to prepare. And so every day we began to prepare. If you were to drive up to our hospital 2 days after that talk, where I was a disbeliever, you'd see a tent in the front of the hospital. You saw a tent behind the hospital. And then over time, beginning the calm before the storm, the ERs, gradually the volume started to go down. Why? Because patients, people, you and I, did what the media asked us to do. And that is to hunker down at home, and that if you're having symptoms, to call your physician. So we did that early on, and we started to see the patient population that looked like the worried well. So patients would come in and they would say, "You know what? My coworker was diagnosed with COVID-19. What say you? What should I do?" And so early on, it became very clear that we had to counsel patients about what to do when they were worried and well. And it largely went like, if you're asymptomatic, cough, sore throat, fever, then you should probably do your best to stay at home. And then if you get worse, then come back to the emergency department. And over again, we got this question. The patients wanted to know, well, how do I know when to come back to the emergency department? And the hallmark of this disease really is as a respiratory disease. And so the hallmark of pneumonia or COVID pneumonia really is breathlessness, is shortness of breath and cough. But it's something that you and I would notice right now, because rather than me be able to talk in 2, 3, 4 sentences at a time without taking a breath, I'd be talking in 3 and 4 word sentences. So we said to families, to friends, if your mother, you notice, if your brother can't talk to you because they're so short of breath, that is the time to come to a hospital. So it went from worried well. The second phase was the viral replication. Our viral replication means kind of what we call the constitutional symptoms. I now have fever. I now have cough. I may have a sore throat or headache or body aches, similar to what you may have with influenza. The trick with the viral replication phase is that when patients came back or came to us, we then at that point in time had to make a decision of who should stay and who should go home, who safely could be discharged. At the beginning of this, the physicians, our physicians, emergency physicians, again, I cannot tell you how grateful I am for the New York experience of my colleagues. They said, John, you have to get on the phone with your colleagues. We did it every night with the ER group. We said, listen, are you noticing that more patients are now having a fever? patients are having trouble breathing. This is probably 2 or 3 weeks into it. Largely speaking, we were 2 weeks behind New York City, so we had some prep time. And I would call colleagues around the area and I'd say, listen, at different hospitals, are you seeing this? You know what, our ER is empty. And then at one point in time, that viral replication then became what we call the adaptive phase. And the adaptive phase is essentially, I have to touch a little bit on the pathobiology, the pathophysiology of this. The virus replicates in the nasopharynx, in this area, up in the nose. And we communicate with ourselves and our children. How often do we touch our face and our nose? This is why when we talk about masks should be above the nose. And we'll talk about masking maybe a little bit later on. So the first virus replicated down in the chest. Coronavirus 1, this one communicates closer to the rest of us up in the nose. Got a shorter distance in order for it to be a little bit more, not a little bit more, but a lot more infectious. So that then sets up shop in the lung on these specific receptors in the lungs and on the pneumocytes. And then if you picture yourself now down into the lungs, you almost think about, my kids and I were talking about this early on, is that what the virus does is that the cells inside of the lung, think of honeycombs. And inside the honeycomb, each honeycomb is dependent on the integrity and the structure of those cells or honeycombs next to one another. Virus went into the cells and caused what we call as atelectasis. So those pneumocytes or lung cells began to collapse. One neighbor collapses, the next neighbor collapses, the next neighbor, and that's what they call so-called cytokine storm is. And so then patients would become breathless and short of breath, the hallmark to come back to the emergency department. One night during these calls with the doctors, we said, listen, what is this virus teaching us? Because we tried to control, right? And then we soon found out that we were not in control. In fact, the virus was the teacher and we were the students. So what the virus taught us was that day 7 to day 10 was when this cytokine storm that you're hearing about on the news, that this inflammatory process that you heard about when you read, usually day 7 was the day of reckoning, was a difficult time for some patients. So what we did was, typically when someone comes in the emergency department and you have pneumonia is no more than, this is what this is. When we talk about the disease, we talk about what happened and how it was diagnosed in China, it was simply an undifferentiated pneumonia. So that means for the layperson or for you at home, that history-wise, a cough and fever is the history that you take for pneumonia. And then on examination, when you listen to the doctor, listens to your lungs, they hear what's called crackles. And that sounds like Rice Krispies, or if you take a part of your hair and roll it in between your fingers, that's called crackles. So that undifferentiated pneumonia, we started seeing probably 3 weeks into this. And then one patient became 2, then became 3, and then overwhelmingly, every patient that came into our emergency department was an airspace disease, or was almost became a respiratory ward. So that we thought we could control patients in 1 or 2 or 3 rooms. We found that most patients that came in that maybe had abdominal pain, maybe had an ankle sprain, when we did screening x-rays, when we did CAT scans, that we found COVID lung, or classic signs and symptoms of coronavirus in the lung. It was quite fascinating. And then that intensified in the emergency departments. And this is pretty classic. And then I would call colleagues, we would call colleagues around, and they would say the same thing. We're getting overwhelmed with respiratory disease. We did a little something special here. If you had an oxygen saturation between, greater than 92%, if your O2 sat was 92% or 93%, 95%, if you had a pneumonia, 90% of the time before coronavirus, you stayed in the hospital. And we said, listen, if we adopt that traditional learning, classic learning, because this virus really challenged us to unlearn classic teaching. And part of that was the degree of hypoxemia or low oxygen level that we would keep in the hospital under normal circumstances, we sent home. And then what we did was we took a nurse practitioner, and those patients that we sent home, we would write an order or a consult in our computer, and we would reach out to them and check in on family members to make sure that their breathing was okay. So that's essentially what happened internally. The adaptive phase came, that cytokine storm came, and then we began to fill up. And this is the challenging part, that healthcare capacity was in fact overrun in certain regions of the country. And that's a question that some people are going to ask. And that once our hospital beds filled with airspace disease, with COVID-19, then the emergency departments throughout the country too essentially became mini intensive care units. Patients were put on BiPAP machines or CPAP machines. Patients were put on ventilators. Administratively, we did a couple of good things. We did many good things. And I will tell you this, as we begin to open up, some advice that I'd like to pass on is that we should have mercy on one another, and we should be patient with one another, because we make decisions, the best decisions that we can in and at that moment. And it may be a good decision on the 29th of May, but a week later, it may be very different. And we learned that early on. So that's essentially what happened. It became the worried well to the viral replication phase, to the adaptive phase, to being stressed to the point where there was time. We never ran out of ventilators, but there were times when advanced airway devices, high flow nasal cannula, ventilators, CPAP machines, and BiPAP machines were in short supply. So that's a little bit about kind of what we saw. And that was probably around 2 to 3 weeks into it. From a personal level and from a personal protective equipment, from an administrative perspective, our question that we asked every day was that, how do we keep our staff safe? How do we keep our patients even safer? And then we just had a continuous rapid cycle of improvement. And what we did was something that most organizations, and namely the church, will have to ask difficult questions about masking, about personal protective equipment. And early on, we thought that a surgical mask was adequate. And then when there were ideas that maybe a surgical mask isn't enough, our New York colleague said, listen, John, if you can do 2 things in your emergency department or in your hospital that will save lives, I want you to think about 2 things. That is to adopt a personal protective equipment strategy that respects the virus to the level of being aerosolized. We know that the virus spreads in 3 ways, and maybe this is going to be some of the questions that are going to be asked. That it is droplets. There's a certain weight to when we talk, when we sing. It's about 12 to 100 microns, the weight. So when we talk, we know that this will spread from droplets. Those droplets are in the air, and then they typically last 6 to 12 feet. We thought it was 6 feet. We may say it's 12 feet. So that's droplet. We thought early on that it was being spread by fomites, and fomites a fancy word for once those droplets get in the air, gravity takes them to the ground, and whatever is in the way, on the way to the ground, it stays onto. So we thought there was a kind of a ubiquitous film everywhere that we were touching with our hands and then communicating with our faces, and that was causing a tremendous amount of disease burden. Now, again, this is weeks past, we do respect the fact that we still think that droplets, meaning that, singing, forced talking, but really coughing and sneezing is something that is quite dangerous with this disease and most respiratory diseases. So that is a little bit about the spread of the disease. Aerosolization, we talk a little bit about different masks. This is the classic N95 mask, and this will protect to a different level than your typical surgical mask. This early on, we put on all of our first responders in order to protect them to a level that we thought was very, very important. So we did that. So that is essentially it. And again, I think we can kind of pass around a little bit. That was the adaptive phase. I do have a lot more to discuss, but I think it'll kind of come out as we move along here.
Thank you, Dr. D'Angelo. Father Anthony Randazzo?
Yes, John, thank you very much for giving us such a comprehensive overlook of the history. And I just want to comment on a few things from the point of view of spirituality and the point of view of keeping people on the faith journey through perilous health concerns. You raised the term pneumocytes. Is that correct? Did I pronounce that correctly?
Yes.
You know, that term pneuma is a Greek word. You know that, right? Pneuma,
Yes,
spirit.
yeah.
Yeah, so as soon as I heard that term, when we speak about spirit and spirituality, all this is so interconnected. And in many ways, as we go about health and spirituality, in fact, there is a magazine that's entitled Spirituality and Health. And what it does is it's always in collaboration with physicians and other healthcare providers on how we go about the spiritual journey and maintain a sense of peace, a sense of serenity in times of that we know and that we don't know. With God and God's experience, we're in the known and the unknown. However, the Spirit is always within us. Not for a moment through all this trial and tribulation is God's Spirit ever away from us. Also, you mentioned that we have to unlearn classic teaching. The virus caused us to unlearn classic teaching. Same thing in spirituality. Sometimes circumstances prompt us and provoke us to unlearn classic teaching about God. And what I'd like to just say very quickly, because I want Bishop-Elect Michael Saporito to say much, much more, is with God, sometimes we have a God that remains only in thought and not in experience. Sometimes our God remains only in an image and not in the interpersonal exposure that God is very familiar with. God is exposed through the compassionate presence of one person to another. God suffers with us. Now, at times, many people would find that teaching to be up against classical teaching about God. God Almighty, God Omnipotent, God who is in charge. But if you accept God as spirit and God as love, love suffers, God suffers with us, God is exposed through the compassionate care and concern of healthcare professionals. The presence of God is with us through the storm. And the church as reality is never only in a building. The church as reality is visible always through compassionate presence. That's all I have to say. I think you gave such a comprehensive look. Mine, I hope, was just a compliment to what you have already said, John. Thank you.
Thank you, Father Anthony. And we'll hear now from Father.
Thank you very much, and good to be with everyone today. I was just thinking as Dr. John was talking about my own experience of how the pandemic kind of broke into our life. I think we've been using the word storm very often, and it got me to go back to the that scene in the gospel where Jesus is indeed on a boat with his disciples and there is a storm at sea. And I thought about how many times I've talked about spiritual interruptions a lot in life, and we basically, those of us in pastoral ministry are hearing about them all the time. They're happening to people 365 days a year. It's a diagnosis, a job loss, a family issue, a personal struggle. And, you talk about how those interruptions sometimes come in life and how this came. So here we are at the height, really, of our Christian celebration. We're heading into we just begun Lent, had the big opening of, Ash Wednesday, heading into the most important and vital seasons, Lent and Easter of the year. It's a time of the year where people gather in great numbers. People are searching for spirituality, and we all get an interruption all at the same time. And it was something that just came upon us all. I mean, Lent began. My election as bishop had been announced, and all of a sudden, in a week or two, from the crowds that we had gathering at church, all of a sudden our churches became silent, and we had closed the doors, and we're all trying to figure out what this interruption was going to be. And I think, even myself, I think at the beginning saying, okay, this is going to be a little bit of something we didn't expect. And, here we are on May 29th. It's been a long time. It's been much more than just a simple interruption, but an interruption in many ways. But, this one wasn't one that we could get away from. You couldn't drive to the next city. You couldn't drive to the next state. You couldn't even get out of the country. This was happening across the world. This was something, very, very unique. From a spiritual perspective, I guess something to follow back on what Father Anthony was just alluding to now, the connections that we make in community. Wow, all of a sudden, I think the meaning of what those connections certainly meant to all of us came front and center stage. I think that, I'm sure that he can attest to, as great as it is to be with you all today, it has felt like we have been talking into cameras for weeks and weeks and weeks and weeks, and not, our interactions with you. And it's not just from a preaching standpoint and coming together at Mass, but then what happened is all the other pastoral interpersonal connections where God is making those connections that Father Anthony referred to were all disrupted. The way you would hold a hand, the way you could look into somebody else's eyes, that you could be physically present with them, that the way that you could touch someone or hug someone, all of it just changed. And while we were trying to do our best and became creative with different ways of trying to tend to people's needs in these times, it was a very, very different experience that made me really, and I think it did a lot of people too, cherish the coming together as community. Sometimes, in the past, some people would say, oh, all you guys, all you do is talk about community all the time. We don't need community. We don't need community. I'm fine by myself. I can do things, but I think we really got a lesson in what true community is about. It's not just a word, and it's not just a concept. It became something that was really enfleshed in us, and incarnate. Well, why did Christ come? He came to incarnate the human experience. He came to be one with us in this experience. And now we understand perfectly why, because when it's from a distance, it's something very, very different. And when it becomes very, very personal to us, it just feels different and is different. And so, and we were all stripped of those connections all at the same time. There wasn't a single person now who wasn't affected by the fact that those connections, the storm, had kind of overtaken us. And we were asking ourselves, just like the apostles did on that boat, why are you asleep during all this, Lord? Where are you? And in actually some of those attempts to reach down and get creative and we're reminding ourselves that that the need to connect was so essential that we were desperate to do anything that we could to make those connections again, even if they couldn't be the same, personal ones, were vitally important to our communities and our people. I'm sure Father Anthony's had the same experience with people saying, thank you for keeping us connected. Thank you for the efforts that you've made to do that, because we recognized how much, that means to us. And I know, I think we've all had, I'll just speak for myself. I've had really days where I really felt that presence of the Lord very powerfully. I've had those days where I've gone, when is this going to be over? How long can we keep doing this? When, it's been tough to motivate some days, and other days a little bit easier. So a mix of those emotions. And again, we talk very often about surrendering our disruptions to the Lord, and we were getting a firsthand, practice of really, what that really meant. And it wasn't always so easy. So we were trying to navigate the suffering and blessing part of our existence. We knew that we were blessed because we were here and we were able to, still have, certain things. And yet at the same time, we were suffering in the midst of it. And I think I just, just in, lots of different things that I could say, but I think as time now has gone on, I said, I think there was one reflection that I'd given, I forget in one context, but it was, I believe it was during the Lenten season, maybe it was during Easter. I said, probably when they go back to write the story of when we get through this, and historians will, talk about these days from all the different perspectives, and they'll talk about, how we got through it. The people that lived through it, us, will understand what the day-to-day struggle was like, and every historical remembrance of this time will probably make it sound a lot easier than it truly was and is. And I think as we've gone on, as we know that Jesus eventually calmed the storm, I think I just saw something that somebody had posted recently on a social media that, yes, we've endured the same storm, but we found out that we've been in different boats, that there's been different implications for different people, whether it was based on socioeconomic situations, race. We're going through the same storm, but different things are happening to different people. And again, I would hope that our spiritual wanting to be with one another, those connections, those interpersonal things, when we start to reopen up our communities, I hope we really remember those lessons. I hope I do. I think I've prayed personally myself that I think as I think about a new role, that I hope I'm going to be a different bishop coming out of this than I might have been going into it, because of the experience we've all been through together. And I hope that's true of all of us, that the lessons that we have really learned about our connectivity, our need for the human touch and community, is something that continues to be in our churches and in our communities, and that we can take those lessons to heart.
Thank you, Father Michael. So perfectly said. So I have some questions. I'll start with, let's see. Okay, so this is for Dr. John. When Mass restarts for the public, is there a risk to consume communion that was prayed over a length of time by an unmasked celebrant? And she said, thank you for being here.
Or let me, if I could comment on before I answer that. I thank you for the words from Father Anthony and Father Michael. There was a time when we first started this that some doctors came out and said, listen, I missed my moment with HIV, and I'm not going to miss my moment again. And the beauty and the outpouring of the human spirit, I wish I could bring people, parishioners, family, friends, those that maybe didn't see the ghost, to see what the response was. I'll certainly never forget it, because there was and there is moments during this chaos, and I don't know that I quite described the intensity of it all, that you could feel the presence of God right next to you. I could feel it with June, who is environmental services. She lives up the street here, and she's our housekeeper. She came in every day. She walked here. I don't know what June makes, but it can't be a lot of money. She picked up shifts. What makes people do that? And she said to me very plainly, is it because if not me, then who? If not me, then who? That's what she said. And then when I felt terrible, when I had patients, family members in their car 40, 50 feet away, and they said, can I come in? And I said, sorry, I cannot let you come in. I cannot tell you how difficult that was. And some of you may have gone through that. But then there's no question I saw the face of God sketched in the eyes and smiles of my colleagues. There is no question that Jesus, the Holy Spirit, was living. And some of the things that I witnessed, maybe I wish that you would have seen these people and us taking care of one another. It was both tragic and very, very powerful to witness. And I think, to Father Michael's point, I hope that this is sustainable. I hope that we pass this on to generations. And the world at that time in the emergency department, in hospitals, becomes very, very tiny. And we just got to hold on to one another. And then you realize kind of what it is and what's important in life. So I kind of couldn't help but talk about that. That's kind of great pause that we went through that Father Rohr talks about. So is there a risk of spreading? I will tell you that the evidence has gone from droplet, coughing, sneezing, as far as risk stratifications, to fomites, not as much. So is there a risk? Yes. There's always going to be a risk. I wish I could tell you with certainty, but when you look at the research out there, might we suggest possibly this is called a novel, new, because we really don't know. There is some risk, but I can tell you that if we wash our hands, if we use good hand hygiene, if we use mask protection properly, when we are having respiratory symptoms, culturally we have to move towards, hey, I'm sick, I'm not a tough guy or tough girl, I'm not going to go to work, I'm going to keep my child home. I think that is important. And if I do have to go to work, I'm going to put a mask on. Do I think that we're going to figure out a way through time to hand out communion safely? No question about it. I don't know what that looks like just yet. And maybe Father Michael or Father Anthony could help with that. There is some risk, but I do know that we will figure it out. That answers the question.
Thank you. This is for Father Anthony or Father Michael. What will the physical setup of the mass gatherings look like? And how about someone like me? I have a severe risk of immune disease.
Well, go ahead.
Go for it, Michael. Go for it. Yeah, please.
Yeah, sure. So I think first, it's a really good question, and it's something that we're all trying to figure out, right now. We haven't even gotten a go-ahead for having a public mass yet, but we are certainly, making our plans. One of the things that is two things that will happen is that, our bishop is not, the requirement to go to mass will continue to be waived. So even when we return, that's one thing. The second thing is that we would continue to stream masses, even though we would be holding them with people present. There would be, and seating is going to be limited. And what formulas and things that we will use to do that, we're talking about right now, but we will, obviously employ social distancing. There'll be a limited on the total number of people that will come. There will probably be, the reality is you probably won't be able to come every single week to church. And that's going to get complicated as to how we do all of those kinds of things. So there's many things, but, and of course the ministers, the priests themselves, and we'll all have to, there will be protections, washing our hands, as Dr. John mentioned, wearing masks, all of those kinds of things will have to be employed as well.
Yeah, could I weigh in a little bit on that? So I would say that we have gone through that. In other words, we have nurses, we have doctors that have comorbid conditions, rheumatoid arthritis, diabetes. They ask these questions and they said, listen, should I come to work? Am I safe to come to work? And I would say that, we didn't talk about it. I kind of forgot to talk about, the on the back end of this ski slope or mountain. My mom, I went to see my mom for the first time, and it's a personal choice because I'm her biggest risk. She has medical problems. I'm her biggest risk, but we talked about seeing her safely, and that looked like physical distancing, and it looked like a hand washing. So proper infection control, and you have to ask yourself those personal questions. My mom said, John, you know what? I've had enough. I want to see you. I want to see your wife. I want to see your 5 kids. And we went down there. Now, of course, my mom wasn't wearing the mask. She didn't want to wear the mask, and she wanted to get close to us, and she wanted to touch us. We're Italian, and of course, I'm using my hands. But and those things are okay. And you're going to feel that way. We're going to make the best decision for you in that moment. But a lot of this is going to be a personal choice until time. What the best test in medicine often is time. Is time. And so the best antidote for this is going to be time, because we're only getting better with therapeutics, medicines, treatments, a vaccine. But right now, our best test is good personal risk-benefit decisions that, like my mom said, John, it's time, and we came down. But again, I think you need to think about it. What's the smartest way to go and see my parishioners? And that's somewhat, it's going to be a personal choice. There is no prescription that has 100% certainty. Over time, we're going to close that gap as therapies, vaccines mature.
Thank you. Well, here's another one for you, Doctor. This is from one of our parishioners. We are truly grateful for our frontline medical teams and essential workers. How is your medical team holding up? And you can imagine there is a type of PTSD after what they have seen.
Yeah. Before I answer, Father Anthony, did you want to weigh in on that other question or no?
You know what, Dr. John, Michael said exactly what had to be said. I mean, there's still certain things. I have some opinions about that, but I want to see these directives first before we begin the public Eucharist. Once we begin the public Eucharist, in agreement with everything Michael's saying, it's going to be compassionate protocol.
Yes. PTSD, some of our questions, I think that if patients need to know the following, and I need to know the following. All of us were affected, and I would say that those of you, like I was able, my life wasn't as disrupted as maybe my mom's or you all. In other words, I got up, I went to work, I came home, I got up. So my rhythm was there. I got to see the enemy, if you will. I didn't just watch it on the news. So for that, I'm grateful, as difficult as it was. Are we going to struggle with PTSD? I think the answer is probably yes. We see trauma every day, but the healthcare community, you and I, have never, and I say we've never seen death in our lifetime that measures up to World War I. This is our war psychologically, spiritually. This is our war. And yes, we should do a couple of things. We ought to give it a name, and we ought to ask for help. So part of the beauty of what's going on right now is that I needed to hear from Father Michael, and I needed to hear the good word, and I needed to hear from Father Anthony. Because that helps us do some inner work and do some, talk about St. Ignatian and the self-examination. I do think it is important for us to look at our daily lives, not just our everyday, but even during this moment, and reflect on where we felt the presence of God in our day. And some of it's just wonderful, but we need to talk about it, and we need to share, and we need, when patients call, or my family have called me, there's not one of us in that have gone home from a shift at a hospital. There's not one of us that hasn't gone to bed, felt great all day long, and right before you went to bed, you said, geez, I start to feel funny. Is it going to happen to me? Is today my day? I sat in the in the driveway, and I have 5 children. Am I going to hurt my wife and my family? And that's okay. That's okay. And I think we have to say it's okay to feel that way. Some of us are going to be very affected. And a good friend of mine said this to me, John, you also have to respect those that may not be, as much as I want them to be, affected by what we just passed through and what we're still going to pass through. Some may not feel that depth of connection, solidarity, oneness that I think we're all hoping that we do. So we need to continue to take care of one another. There was nothing more important than the rhythm of my day ending with the following, and that was this. That was going home and speaking to my mother, my brother, another doctor, a patient, and saying to them, are you okay? And you don't need a medical degree to do that. Mm-hmm. You don't. It's not, you don't need a white coat. You don't need fancy education. You need to tell people that you care about them. And that is the medicine right there. And that's why I'm thrilled to be talking about this. So you're right. That answers the question.
Thank you. This one is for Father Anthony and Father Michael. Have you seen good numbers attending your masses online? And we so miss the in-person community, but have been so grateful for all your efforts to continue virtually. We were happy to hear from our daughter's college, Loyola, that their Sunday numbers were so strong for their Sunday Mass. Will a Mass continue to be live streamed for those at high risk? I think you answered some of that earlier.
The only thing I would add to that is thank God for Marina.
Yeah.
I mean, the bottom line is all the live streaming, all this technology, if it wasn't for a millennial of good mind and good heart, we'd be in trouble as far as communicating the gospel message through modern technology. Thus, very grateful. And yes, the numbers are very good. They are, I think, outstanding, to be quite honest with you. It might even be more than generally would have come in prior to the pandemic. Yes. But very grateful to Marina for facilitating all this communication of the gospel. Thanks, Marina.
You're welcome. Happy to serve. I know St. Helen's numbers are very good as well, because I do also help out with St. Helen's live stream. Both churches have amazing numbers for online Mass, so yeah.
Can you tell if we miss Mass? Is there a button that comes up if we miss Mass?
Yeah, I can take attendance. I'm totally kidding. I'm totally kidding.
People are asking me, can you? I don't know.
No, but God is taking attendance.
God is taking attendance. The Lord sees everything. That's right.
Yes.
So we have time for 2 more questions. One parishioner asked that she's curious about the different perspectives about how the grieving family members who could not be with their dying or their dead loved ones were comforted.
Can you repeat? I'm sorry. Can you? The question was.
This particular parishioner is curious about the different perspectives about how the grieving family members who could not be with their dying or dead loved ones were comforted.
Yeah, that was definitely. Go ahead, Dr. John. Did you want to go?
No, go ahead. You can lead off. You can lead.
I think that sometimes, again, because the technology allowed depended on the health. Some people that were sick, sometimes we could pray with them. Again, using
Frozen.
using technology and allowing us to just see them face to face and pray. Sometimes somebody held the phone near somebody's ear. I had one family that had different relatives in different parts of the country, and somebody was dying, so I prayed with the person that was locally, but then their relatives called from different places, and I think they had 5 or 6 siblings, and I think I prayed with each one of them separately. However we could do it, again, because it was so unnatural, from the sense of, you would have gone over to those houses, you would have gone right to that hospital, you would have gone right to that nursing home, and you weren't able to do all of those things necessarily, that you used any and all ways to make the connections.
Yeah, we did similar things. We did use telemedicine to bring the families to the bedside.
Yeah.
Yeah, that's what we did. And some of the nurses even used their own phone. They said, you know what, I'm going to make it happen. So we did that. We also, we are a Catholic hospital, and we had, unfortunately, to keep our pastoral care, our priests and our sisters of charity, they wanted to come in and they wanted it, but we had to say, it's just not safe. I appreciate you. I understand you want to be here, but it's just not safe for you right now. And that was difficult.
One last question. Will you be conducting or are thinking about having any outdoor masses or sacraments such as baptism or weddings in the near future?
Well, I don't know what the official directive is going to be on that, but this is only a personal opinion. When it comes to the celebration of the sacraments, most of the ministry of the Christ was done outdoors. Very little ministry was done in a synagogue. Most of it was done along a beach. Jesus was baptized in the Jordan, which is outdoors. So as far as I'm concerned, I would love to see permission for, during this time, the celebration of baptism outdoors, the celebration of weddings outdoors. We celebrate the rite of committal, which we had been given permission for. It's outdoors. All for the outdoor celebrations of the Christ presence, based upon how Jesus conducted his ministry in the first century, which was mainly outdoors. Now, I don't know if those directives are going to come through in that kind of way, but I just want to weigh in. If it was good enough for Jesus in the first century, it should be good enough for us in the 21st century.
Thank you. Well, we don't have any more time for any more questions, but if anybody wants to email me separately, I'll try and get them answered for you. Thank you to the panelists. The information was fabulous, very heartfelt, very informative, and very fulfilling. And I hope everybody else feels the same way. So stay well, everybody. Stay safe, and God bless.
Thank you. Thank you, Michael.
Okay.
Thank you,
Bye-bye.
Thank you, Marina.
Thank you.
Have a beautiful weekend.
Yes.
You
Have a
too.
great
Bye-bye, everyone.
Bye-bye. Thank you, Lori. Thank you.
Thank you.